Kerajaan Malaysia diberi tempoh 24 jam untuk memulangkan semula keseluruhan dana dan aset berjumlah lebih daripada 114 juta ringgit kepada Datuk Seri Tun Razak dan UMNO. Pihak berkuasa dan Kerajaan Negeri Kelantan disaran supaya memaklumkan angka sebenar dan peningkatan kes COVID-19 setiap masa kepada rakyat Kelantan bagi menimbulkan kesedaran. Kerajaan perlu memantau semua NGO yang membantu misi kemanusiaan rakyat Palestin sama ada yang mendaftar atau sebaliknya. Laporan penuh di saluran 501 dan astroawani.com.
Khabar baik untuk semua rakyat B40. Dengan Yes Prihatin belajar dari rumah, Yes memberikan telefon pintar percuma dan data percuma. Tiada deposit, tiada kontrak, tiada bayaran. Ini memang milik anda. Tuntut sekarang di yes.my/kasih-up B40.
Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. As the federal government's National Covid-19 Immunisation Plan picks up pace and continues to evolve, the involvement of state governments have now taken centre stage. Tonight on the show, we're going to be speaking to COVID-19 committee representatives from state governments of Selangor and Penang and be asking them about the specific challenges they face at this time. Let's begin with Selangor. Datuk Seri Dr. Dzulkefly Ahmad is the chairperson of the Selangor COVID-19 Task Force. Dr. Zul, thank you so much for joining us on the show tonight. The federal government says that it will meet tomorrow to decide whether or not to implement a quote-unquote full nationwide lockdown, which presumably means further movement restrictions and the suspension of most business activities. Now, I'm just wondering what you think will be the consequences for Selangor if federal pushes for a complete lockdown without the support systems that you've mentioned in the press previously, everything from widespread testing and increased vaccination.
Right. Yeah, Melissa, thank you for having me again. All right, let's get straight to all this anticipation, anxiety, building up as to waiting the announcement tomorrow. But let it be very clear to all of us, right, that what is it that you are wanting to do with this lockdown? Yeah, this is most important for us to address because until and unless you get to know what you are in to do, we are only saying that the lockdown is necessary now, if at all it is necessary, is because that the health facility, ICU, ventilators are overwhelmed. And we are in fact just delaying and prolonging this outbreak so that we will have time to recuperate, to using this respite to beef up our health facilities. Nonetheless, we must understand that the virus is not going to go away. It's going to come back again. So the more longer-term strategy is what is in question. Whether we do have that or will we suffer the MCO 2.0 again, and then there will be another MCO 4.0, 5.0, and so on. So this is very important for whoever wants to make that decision to understand what is it that you are in to do. If it's only to delay, then you've got to put in place all those strategic measures, public health measures, beyond just the three C's and the 3W, doing the 3 C's, avoiding the 3 C's and doing the 3Ws. So that is my first, and of course, you must remember, lockdown is never, it's got serious collateral damage on economy, on livelihood, on school children and whatnot.
Dr. Zul, there seems to be at least some segment of popular opinion that is supportive of a lockdown, but it does seem that it's driven, one, by the fear generated by those numbers that we have of new infections, of deaths, and two, by this perhaps mistaken idea that a lockdown is a kind of silver bullet, that it will actually end the pandemic. How do you address these, these fears?
There can be no greater folly than to believe that lockdown is the exit strategy for this pandemic. There can be no greater false and wishful thinking on that. Perhaps we will talk about vaccination later as a silver bullet, but not lockdown, certainly, Sharaad. Lockdown is an approach, is a public health approach to only delay, further outbreak. So you break the transmission, but the virus is not going to go away. The important thing is, during that respite, you beef up your health facilities. So no way would you be able to use this as an exit strategy. It's very wrong, right? Because you cannot be prolonging your lockdown when you see numbers. Numbers is certainly now very, very serious. We have never gone to this 6,800, with Selangor contributing about sometime 1 to 2,000. So yes, it is serious, but how do we handle this? We shouldn't be panicking, but we must remain, go back to the drawing board, get our strategy right. And we have been talking about this and all those things that I have said earlier, and I will elaborate it further again. So right. No way can you just do lockdown as an exit strategy, Sharaad. Sorry.
Before we go into the strategy, I wanted to come back to something you said. You said, we need to know what the aim is of this lockdown, whoever makes that decision. I'm wondering, Dr. Zul, will Selangor be part of that conversation in making the decision? I mean, Menteri Besar Ahmad Dr. tweeted out earlier that his attendance will not be required at the meeting tomorrow.
It's not required?
Well, he tweeted out that he would not be attending the meeting tomorrow.
What a shame!
Could you help clarify?
I wish I would be together with him as the chair of STFC, and even others like Prof. Adiba and Dr. Christopher Lee and others.
Have you been contacted? Will you be attending?
Not at all, but I would. We have been sharing our thoughts to Menteri Besar, and we really wish that he would represent us at least. But now that we know that he's not attending, it's such a big shame, and it's very regrettable that if he's not attending it.
Well, we hope that
there
changes.
Seems to be there seems to be a long-standing.
This is very much against the idea of a whole of a government approach, much less the whole of society's approach. I'm going to be talking later on mobilizing the entire resources in the society. But this is whole of government, federal and state government must be together on this. We want to be winning this war together, Sharaad and Melisa. But this is, I'm really upset by. It's really regrettable that he's not attending. Can
I just quickly clarify, Sharaad, that he has tweeted to say that he has just received information that he will be now invited once again. Yes, he's just tweeted that out.
Wow, what a good news! STFC not attending is one thing, but Menteri Besar must attend as the head of state.
Agreed.
Leading the what you call it, the MKN of the various respective states. They must attend.
Okay, Dr. Zul, if we could turn attention to how the Pakatan Harapan coalition has presented its analysis of the problem and what it wants to see happen. I wanted in particular to address the question of vaccine supply and what is seen as bureaucratic red tape that is preventing us from either getting more different types of vaccines into the pipeline. Could you please address that?
Right. This is a very pertinent question, Sharaad, because for the fact that Minister Khairi Jamaluddin has said that already he's admitting that the first phase 3 immunization would have to be delayed because of insufficient supply of vaccine, right? Now, seriously, this is against all those plans, whatever numbers that he mooted 75,000 once upon a time, and the Minister of Health mooted by the idea of alluded to 126,000. All those now, goes down the drain. Now, what we are doing right now, we are at a very snail pace rollout of our vaccination, right? And this is very much, regrettable, again, if I may use the word. So this very slow and ineffective, vaccination rate or rollout must be addressed. And this is why we thought that it's so important for us to, one, speed up NPRA vaccine approval. We have got 3 so far. Why have we been delaying? Why is NPRA, the National Pharmaceutical Regulatory Agency, delaying on getting others on board so that we can have a good mix of a basket of a vaccine of sort. You've got to have other portfolio of vaccine so that we will not be limited to only 3, the Sinovac, the Pfizer, and the AstraZeneca, but as well others like the Moderna, and as well J&J, Janssen, and this is also very important, and as well Sputnik V. So firstly, how do we speed up? How do we speed up NPRA vaccine approval so that you can, given the crisis situation, you've got to have crisis management, then expand the basket of vaccine mix, and thirdly, of course, to allow state government and private hospital to come in to provide vaccine to the more able and willing paying customers over and above, the other groups that we know very well that must be given earlier, like the oldies and others with underlying diseases and chronic diseases of the NCDs. So Sharaad, this is a challenge. Are we able? Because for all that we have said, to use this of getting the exit strategy or the silver bullet of sort, but the snail pace rate of vaccination is much to be desired. We have got to ramp it up. We have got to mobilize the entire resources, the entire public, private, and everyone, including the other organization, medical health professionals, even medical students, to get into this so they can really ramp up to have a semblance of a community immunity, not if it's not a herd immunity as such.
Dr. Zul, how these measures that you talk about, how quickly can these measures be put into place? Is this considered an immediate short-term measure, or is this something for a longer-term approach?
Immediately is about vaccination. As we have got to, the onus is on the government, to get NPRA to provide this, NPRA's registration of the other vaccine candidate. That's one. But over and above that, of course, on the vaccine is there must be together with the idea of a exit strategy for vaccination, all those strengthening of our public health measures that talks about the free mass targeting testing, the community management by way of how we manage our CACs, the COVID assessment centers, how we use those digital tools to automate and to actually monitor those at home, and then to get them to CAC immediately. Immediately there is a red flag up because of if they do not get twice, not answering your call. So all these measures, all these tools, Melisa, must be put in place quickly, right? Because otherwise, you will always be trailing behind the virus. And this respite that we are given during the lockdown, if at all we are going to go for a total lockdown, must be used to really strengthen our automation, what we call as the free mass targeted kind of testing or free mass testing. When you say mass testing, you got to go down on a mass scale. I can talk
Dr. Zul, sorry. In the last minute so that we have, very quickly, Selangor has talked about procuring vaccines. What vaccines are you looking at? Will NPRA, in fact, give you the green light to use those vaccines, and who will you be using it for?
Oh, all right. That is a non-issue at all. In the sense that the NPRA, the federal government, must give it to the state government, and in fact, for that matter, they must facilitate us because the vaccine candidate would be the one that they have already given NPRA, a registration. The DCA have registered them. That would be Pfizer, Sinovac, and the AstraZeneca. But we are saying that if we increase the portfolios of vaccine that are available, then we have a better chance of getting to overcome that bottleneck of supply. So yes, we are nonetheless be looking at those candidate vaccine that are already registered or getting in the pipeline to be registered, Sharaad. So we want to be given immediate. All state governments like Selangor, Sarawak, Penang, they are all in the same boat actually. They are not even yet given, although Sarawak sort of mooted the idea or make announcement of their, given that we are all in the same boat. So as soon as the federal government can act and allow us to procure, we will be using them Firstly, of course, on those that will have to be, catered for by of the oldies that have not been, vaccinated, and on the rakyat. But more importantly, as I said, particularly Selangor, is to provide our so-called, economic frontliners, protect our industries. Those are very important at the end of the day for us to make sure that Selangor will continue to, give a breather to our economy, industries, and as well, the entire livelihood. So yes, we know exactly whom we are targeting to roll out the vaccine that we are procuring, Sharaad and Malaysia.
Dr. Zul, thank you so much for joining us on the show tonight.
Appreciate your time. A lot more to say.
That's all the time.
That's all. Okay.
Well, we're going to be looking at Penang's strategy after this, so stay tuned to consider this.
Depan kita bagi hentikan. Induk ini adalah Melayu.
Balik kepada Islam. This is chain reaction. Polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita sudah tentu dia akan datang daripada pemimpin wanita.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop the spread of COVID-19. Social distancing, face mask, follow these steps, this SOP with the utmost discipline. Together, we can flatten the curve.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. Awani 745 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, Reformasi, Resistance and Hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro Awani sekarang.
Semua yang terjadi adalah berita, tetapi tiada siapa yang boleh bawakan yang terkini dan tergempar seperti kami.
Dilihat hanya memberi wang tanpa matlamat yang tepat. Dia tidak melakukan apa-apa kesalahan.
Untuk mendapatkan jawapan yang bermakna, kita perlu soalan yang tepat.
Amat sedih dengan apa yang berlaku ke atas.
Tiada ruang untuk berita palsu.
Negara kita telah merekodkan kes harian baru sebanyak
hanya fakta yang diberikan.
Amat penting untuk meneruskan perjuangan negara melawan pandemik ini.
Sentiasa memastikan suara anda, suara rakyat didengari.
Kenapa?
Membawakan apa yang penting di mana sahaja anda berada.
Kerana kita hendak putuskan rantaian jangkitan.
Belanjawan dan pendekatan bertemakan survival ini secara keseluruhan.
Teruskan bersama kami, Astro Awani, saluran berita yang paling dipercayai rakyat Malaysia.
Kenapa semua orang buat webinar ni? Because it's awesome and powerful. Astro Awani Link ialah norma baru untuk memperkasakan diri anda. Learn things that could help you live a better life. Interact and network with like-minded people. Melalui digital, kolaborasi boleh terjalin di mana-mana sahaja. Create solutions that suits you, meanings that enrich you. Dengan pengalaman dan kredibiliti kami, webinar di Astro Awani Link menyatukan anda dengan our experts, your heroes. Platformnya, Astro Awani Link.
News is a constant. Whatever the time, wherever you are, it will reach you. What's key are its credibility and accuracy. without bias, with context covering all angles. This is what you'll get on AWANI Tonight. We'll brief you the news and views of the day that matter, all in 15 minutes. Weekdays at 9:45 p.m. only on Astro AWANI.
Thanks. Hi. Thanks so much for staying with Sharaad and I on Consider This. Let's continue our look at state-level strategies for the immunisation process. Dr. Norlela Ariffin joins us now. She's the chairman of the Penang State Government's Health Committee. Dr. Norlela, thank you for joining us on the show tonight. Now, can you begin our conversation tonight by maybe helping us understand the root cause of that ongoing exchange between the Penang Chief Minister and the Federal Musti Minister over the purported unapproved donation of vaccines? Now, I'm quite curious to understand the root cause of it, because why is the Penang State Government strategy opting for a donation as opposed to procuring vaccines for itself?
Oh, okay. That particular request was way back in February, and I was not the EXCO for Health at that time. So I don't know much about what was the detail, because I only saw the letter during the press conference. So
but in terms of the strategy. In terms of the strategy for the Penang State Government, is it relying on donations like the one that has been in the headlines, or is the Penang State Government looking to procure vaccines for itself to help speed up the immunization process in the state?
Okay, all this time when we've been having in our CITF meetings with YBKJ and also KKM from the beginning, we have been told that this is a program that is under the federal government and it is not necessary for us to do the procurement. It's just that in the early stage, I was informed in one of the meetings that there was a company or an organization that had offered to give a donation. So it's not part of the strategy that in all our meetings, our MTN meetings, and also in our CITF meetings at the state level together with the federal government, we have always implemented, or when we plan, even from phase 1 until now, we are moving into phase 3, is always with the assurance that we are going to get the vaccines from the federal government, that it is the responsibility of the federal government to provide the vaccines to the state. It's just that recently, because of the news about Selangor and Sarawak, then we heard that they are planning to procure. But I actually did contact YBKJ as well as YB Menteri Kesihatan to ask them what is the if the federal government could assist us to do the same, meaning to procure just like what they have done. So I did ask in terms of the cost as well as the delivery. So I was informed by both ministers, especially YBKJ, that the procurement is done with the federal government, and therefore the delivery, the contract with the manufacturer is with the federal government. So if there is any leftover, then the state government could procure. But they advised, YBKJ had advised and said that it was not necessary for us to buy because he was going to deliver the vaccines. And our CITF meeting today, we actually discussed the delivery. We are receiving it in a few days. I mean, we do know how many vaccines are coming in and all that, yes.
Okay, Dr. Norlela, I think what we're also trying to understand is how Penang thinks about the kind of complementary role it can play. The Penang government playing a complementary role to the federal government in both the vaccine rollout and also in the pandemic management strategies. Is there something that Penang wants to do differently, thinks there are, gaps that needs to be filled and that it can fill those gaps? How can we understand if Penang has a strategy that works along with the federal government?
Okay, we do understand that the federal government is going to, they actually mostly came yesterday also, and we had a meeting today. They are going to open up what you call the mega PPV at Spice. And they are bringing in the AstraZeneca we are going to open it for people to register. The priority is for the warga emas to register beginning on the 23rd of May. So that is one based on the warga emas, right? Because AstraZeneca is more suitable for warga emas. But at the same time, we have actually today, I think the CM has launched Penang Safe, where we are working with the industry as well, with FMM, so that we are planning to do the deep throat saliva test kits, so that the industry.
Dr. Norlela, is that mass testing? Are you talking about mass testing, particularly among Penang's industrial zone?
Yeah, because we find out in Penang, a lot of the clusters initially were from the industry, because Penang is highly industrialized. And a lot of the other economic sector, they basically say that, a lot of the clusters are coming from the kilang-kilang, from the factories. And therefore, I had suggested to YBKJ that, if that's the case, why don't we just focus on the source of the infection, and therefore basically to have on-site vaccinations and also on-site testing, because if not, there's going to be a lot of economic loss. And because a lot of the people are also working in the factories, it also, like if their parents, there's infection going into schools, there's also infections going into the normal population. So we are planning to have what do you call this, with the economic sector vaccinations. We are working together with, as of today, I've been approached by a USM as well as Pharmaniaga, where they are going to have a rollout for the economic sector. So having USM as their distributor, because USM does have the necessary infrastructure in terms of the temperature for the vaccines, the logistics of it, and plus USM also have the doctors. So,
Dr. Norlela, that sounds very interesting. That sounds very interesting. Unfortunately, we've run out of time, and I wanted to say we'll be keeping a close eye on that development. It sounds like it's an interesting development, but thank you so much for your time tonight. We appreciate you joining us on the show.
Okay, sure.
That's all.
Thank you so much.
That's all we have for you. Thank you. Okay. That's all we have for you on this episode of Consider This. But before we leave you tonight, a reminder that you can get all your news on COVID-19 vaccines on astroawani.com and the Astro Awani app. Thank you so much for watching. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off the evening.
We'll be back with you tomorrow. Till then, good night.
Good night.